Our second session of the day is called Long-Term Care Support and Services into the Future. To confuse you, we've moved Bob down from that end to here. So please welcome him back. He's going to moderate this session. So, joining Bob will be Warren Jones with the American Academy of Actuaries, Lee Goldberg with the National Academy of Social Insurance, and Beth Ludden with Genworth Financial. Mr. Jones is director at PwC in the U.S. Actuarial and Insurance Management Solutions practice, has more than 36 years' experience as an actuary. He joined PricewaterhouseCoopers long-term care practice in January 2015 and provides actuarial consulting and assistance regarding audits of insurance company clients. Lee Goldberg is vice president for health policy at the National Academy of Social Insurance. Lee has over 2 decades of experience working with individuals and groups concerned with health and long-term care. Beth Ludden is vice president of in-force long-term care products for Genworth Financial, covering their long-term care business, and she's based in Richmond, Virginia. She has 20 years of long-term care industry experience and has maintained an active involvement in a number of organizations that focus on long-term care issues. So without further ado, I'll turn this over to Bob, and he's going to take the panel through the next session.
Thank you very much. You're going to learn everything you ever wanted to know about long-term care but were afraid to ask. What I'm going to do is direct a question to a particular panelist who will be the primary answer, and then the others can chime in with their thoughts on the subject, and I think we can have a good discussion. The first question is, how are long-term care expenditures typically covered? What does Medicare do? What does Medicaid do? What do people do out of their own pockets? And I'd like to start with Lee.
Hi. Whoops. Let me put that back a little bit. Good afternoon, and thank you to NAIC for having me here. Long-term care expenditures, and this is expenditures for people who have at least two impairments of 2 activities of daily living. So that's sort of the baseline that triggers it. There was about 211 billion spent in the last year. We have data on long-term care. And about 62%, 63% is Medicaid, so that's federal and state. About 21% is paid for by consumers out of pocket, either by themselves, either them or their family. About another 12% is from insurance, primarily long-term care insurance, but some other health insurance in some cases. And about 5% from other public programs, so VA, Medicare, Older Americans Act, other revenue streams.
And next for Beth, this is a subject that I always wonder about. How do people think about it? How have perceptions changed? Do people know what they will need? Or does it become as a big surprise to them when some long-term care necessity comes about? Beth?
Good afternoon. Thanks for having me. Over the years, consumers have changed their perceptions of long-term care. I think primarily because originally when these products were being sold, we were selling to people that were already average age about 70. It was and relatively speaking, it was very easy to sell to a consumer who was around age 70 because they had already seen that something happened to their friends. And so the underwriting was a little bit lighter in those days, and so some of them could actually, select a little bit against the insurance company, and they knew that there was something not only was going to happen to them, that they would actually benefit from this insurance, potentially. So very, very different than where we are now, where we're trying to conduct this sale as part of retirement planning. And we're primarily focusing on baby boomers as the cohort that we're trying to get to purchase the product. Unfortunately, baby boomers are very resistant to retirement planning. I think if you look in the financial literature, you see that baby boomers haven't saved enough. They just don't take retirement seriously. They're going to do something different in retirement than anything that's been done before, because they've always done something different at each juncture of their life than what's ever been done before. So it's much, much harder to get a baby boomer to focus on long-term care insurance. For other reasons, they also have a shared wallet issue. Many of them had children later, so they're still paying for college education. They never did pay their house off. There's just a whole wealth of reasons why baby boomers just don't think about long-term care insurance seriously. And no, they have no idea what their future holds for them, because they never have really focused on that. We're really much more of a present-day generation.
Could I add a comment on that?
Sure.
Which is, so there's this, in terms of the extent of long-term care needs, so 42% or so, low 40% of people don't have any long-term care expenditures. They have an acute care illness, or if they have long-term care needs, they're able to get help from family and friends, and they don't have to spend anything on it. And then at the other extreme, there's about 16% of people who spend over $100,000 in long-term care. And it's sort of like, we all live in Lake Wobegon, right, where all the children are above average. 100% of people think they're going to be in that 42%. So it's exactly what Beth says.
So then, as both of you suggested, we're not prepared, not thinking about it. So for Beth, okay, what will the government do for me when I need this? What are the public programs? Let's say I haven't even thought about talking to one of your salespersons. So I'm saying, okay, Medicare will take care of it.
That's correct. Most people do believe that Medicare will take care of it, despite the fact that if you actually read your Social Security statement, it will actually say something to the effect of Medicare doesn't cover long-term care expenses. But again, baby boomers haven't paid that much attention to it. Some baby boomers have some big knowledge about Medicaid. Well, Medicaid, that's something that'll pay for my long-term care expenses. Maybe they've even had a parent who qualified for Medicaid. So there's no understanding whatsoever that ultimately, if you're looking for an insurance program, whether it's public or private, that will pay for your personal care services, and that's what most of long-term care is. It's paying for personal care services. It's not going to the hospital. It's not going to a physician. It's personal care services. If you're looking for that coverage that you can reliably depend on, the only game in town is long-term care insurance. Most people have no idea.
Let me ask you, when you say, what do you mean by personal services? We're talking not the doctor or the nurse, something else. What are we talking about here?
So, and again, this isn't an unpleasant thing to envision, but when people need personal care services, that means the things that we all did this morning to get ourselves ready to face the day. It means getting up out of bed. It means showering. It means dressing. It means eating. It means toileting. All of those things are things that older individuals can't do by themselves or can't do without supervision. Complicating that, of course, is the prevalence that we just heard about around Alzheimer's disease. People with Alzheimer's disease may have the physical capacity to do any and all of those things. However, the likelihood of them doing them properly is remote. So they need help and supervision just to do all of these very simple tasks that we don't give a thought about. Those are the kinds of personal care services that long-term care insurance and long-term care services and supports are comprised of.
We had a lot of discussion about the Affordable Care Act, and one of the selling points was that this was going to take care of the problem, that the Affordable Care Act would do something about it. Well, Warren, tell us what happened with that idea, with the ACA and long-term care.
You need to press the button.
Okay. I thought it was green. There. The profession had a number of concerns about the Class Act, specifically because in the aggregate the provisions would create adverse selection. The class program had a guarantee issue with a week at-work requirement, and further, non-working spouses were also eligible. There was opt-in, opt-out, which allowed people to delay enrollment until they could foresee them needing benefits. There was a premium subsidy such that there was a $5 premium for students and people below the poverty line, and that would create higher premiums for the other enrollees. The program had a 5-year waiting period, and let me describe that. That's a period after enrollment for which you're not eligible for benefits. But 5 years was not adequate to mitigate the anti-selection created by the other provisions. There was also limitations on rate increases such that if people were attained age 65, had been enrolled for at least 20 years and were no longer working, rate increases would not apply to them. So the entire burden of rate increases would fall on the younger enrollees. And finally, there was benefit design features like cash and an unlimited lifetime maximum that would induce demand for the plan. So all these in the aggregate would create adverse selection on the plan.
Now, I want to make sure I understand that guaranteed issues so that government couldn't turn me down, right?
That's right, and that's unlike...
so why not I wait until a month before, I wait until I know I'm going into the nursing home and then I buy the policy?
Well, you still have a 5-year waiting period.
Oh, okay. All right, so I have to have at least 5 years for it. Okay, so what, go ahead.
There were also some penalties for not joining in immediately as well. So.
Right. I mean, I think one of the tensions, and those of us who worked on the legislation were aware of this from the very beginning. It was sort of the nature of coalition politics. It wasn't clear if this was an insurance plan or a benefit plan. And, because of the design flaws that Warren points out, it was really much closer to a benefit plan, and so actuarially it didn't work. There were, it's worth noting that, so class crashed and failed, and to a certain extent, there's an argument it could have been fixed. It wasn't because of the whole political environment around health care and the ACA. There was no interest in trying to compromise. One side basically wanted a scalp to have from the other side. But there were actually a lot of provisions in the ACA that were very important for long-term care on the Medicaid side. Right? So there were a number of provisions in the ACA that help states financially and otherwise in expanding their home and community-based services and getting away from the institutional bias that Medicaid traditionally has. So because under Medicaid, states have to offer nursing home care, but they don't have to offer home and community-based services. And there were a lot of provisions in there to help incentivize states with more federal matching money and elements about how they should structure those programs and changes in waivers and things to help states do offer home and community-based services. And that was really important. And over the years, that'll have a large effect on Medicaid. So.
But right now, there is not a government policy one can buy. In other words, the AC, that is no longer in effect, right?
Right.
Beth, you were mentioning that the boomers don't really know that they're going to sometimes need this. So does that mean special marketing efforts or or educational efforts, or what happens?
So there have been state and actually nationwide educational efforts in the past to encourage the purchase of long-term care insurance. Certainly the original partnership programs in Connecticut, California, Indiana, and New York that were put together as a demonstration project by the Robert Wood Johnson Foundation to create a product that, if purchased by the consumer, would protect assets in the event that the consumer continued to need care beyond the limitations of the policy. So in other words, when we were talking earlier today about Medicaid look back and trying to buy an annuity that would protect your assets from Medicaid and your income from Medicaid, This program actually, in some respects, meets that head on, and actually, has the construct where if you buy, the consumer is told if you buy this policy and you still need to have care beyond the confines of the policy benefits, then you'll be able to tap into Medicaid, assuming that you meet the qualifications, but you will not have to divest yourself of some asset that is valuable to you, some asset that you wanted to leave to your children or to some other organization. That program had great success initially, and I think that it also produced some of the really beneficial aspects of the policy that we see today in terms of defining the benefit triggers, criteria for care management. I think it forced insurance companies to step up their game a little bit around the product itself. Additionally, we've had other little bursts over the years. HIPAA tax-qualified benefits have added a little bit of oomph to the sale when you can go to the consumer and say that this particular program is tax-qualified, meaning that, and this is unique in the insurance world, where you can purchase a policy and get the benefits that both your premium could feasibly be tax-free, and the benefits are definitely tax-free. That's huge. Normally, the federal government likes to get their cut of the action somewhere, either on the premium side or the benefit side. But in this scenario, long-term care insurance has very favorable tax treatment. So that was a bit of a boost. We also had another boost with the revival of the partnership with the Deficit Reduction Act, where policies again were clarified around their ability to be tax preferred. We've had something called the Own Your Future campaign, which was sponsored by HHS, and states had to apply in order to get the benefit of that program, but it was basically an advertising campaign that came out from the governor of the state with a letter that was sent to everyone between the ages of 40 and 70 saying, hello, I'm your governor, and I'm here to tell you that you need to plan for long-term care events in your future because there isn't a program that you can rely on that is government funded. It was not just focused on insurance per se. Reverse mortgages were mentioned, annuities, that type of thing. So it did run the gamut. But the point of it was to create the environment where consumers are made aware that there is not a government program that will pay for your long-term care expenses. By virtue of the fact that the federal employees have their own long-term care program, that increased sales for us again because there was a concerted educational effort that said, hey, you need to stop and think about what's going to happen as you grow old. When you grow old, your risk of requiring certain services increases. Here's a product that if you purchase it will help you pay for those services. Very simple message. And each and every time the government, a state, the feds, whoever comes out and tells consumers about this, they take note and sales go up. However, it's iterative because as soon as the program stops sending out those mailings, it all goes away again. So our challenge, I think, is to find a way to continue to educate consumers around the need for long-term care planning, whether they choose to insure or save or buy an annuity or whatever. We need to help people understand that this is an important aspect of planning for the future.
What percentage of families, let me just ask, what percentage of families have it, or boomers, let's say, have long-term care insurance?
That's a good question, and it depends on how you want to think about it. If you are, splitting the cohort by, age and or health and wealth, then in some cases penetration is almost 20%. But globally, it's no more than 5% of the population that could feasibly buy it really has it.
Lee?
It's interesting. There's some research out of Boston University. Boston? Yeah, I think it's Boston University. That shows that it's just not clear on these partnership programs, and I think it'll be interesting to see going forward. They're relatively new. The states have subsidized private long-term care insurance. Most of those policies are not in force yet. And when they do, there's going to be all these folks who are going to be claiming Medicaid, who probably a large percentage of them were not going to be on Medicaid at all without this. And so there's some initial work that they've done at the Center for Retirement Research at Boston University about that there may be a net loss to states from this partnership program. And, it'll be interesting because it's very skewed in terms of what the income effect is and who uses it. And right now everybody's enthusiastic, but it'll be interesting over the next 10, 15 years how that plays out.
Let me ask first Warren and Beth to respond to this. So only 5%, that's a pretty tiny share of the market. Why is it so hard to come up with a product that 50% of boomers will want to buy? Is that you can't make it cheap enough? It's hard to understand? Or what? Why is it so hard to get a good product?
Oh, well, there are good products out there, and it's just a matter of getting the people to actually buy the product. The people who have had a long-term care need in their family know the value of it, and it's not a real hard concept to communicate to other people, but there is just purchasing resistance. And that's my view. Beth, do you have any other comments?
Yeah, I would say that, I mentioned earlier there's just conflicts with share of wallet. People love to kick the can down the road, especially when it's a topic that they don't want to think about anyway. I could embarrass everybody and ask how many people have a long-term care insurance policy here in the room, but I won't do that because I already know what the results will be. But I think everyone understands that it's something that should be considered, but I think there's a lot of confusion. I think, people just find a million reasons why they shouldn't have to purchase this insurance. Affordable care caused a slump in sales because of the Class Act. The feds are finally going to put a program in. Even at the Affordable Care Act, there was confusion about, taking class out of it. People still sometimes believe that because of the expansion of Medicaid and because of the changes in Medicare, that somewhere in that mix there is some additional benefits for a long-term care event. One of the things that we did recently at Genworth was we did some private research with millennials and their attitudes towards long-term care planning and that sort of thing. And it was very interesting because, as we've already noted, millennials have a little different attitude than baby boomers. What we asked was, how do you feel, what do you know about long-term care, and how do you feel that your parents have done around planning for a long-term care event? And it was interesting because millennials have already observed that their parents have been caught having to care for their parents. So the millennials' grandparents, they've already seen their parents have this work-life balance issue. They've seen them struggle in some respects around trying to care for their parents and help their parents through a long-term care event. And so they're actually much better versed at a much younger age around what long-term care is all about. And in general, interestingly enough, they have seen their parents, their baby boomer parents, take no action, even though their baby boomer parents have already had the experience. And still, they've not chosen to take an action. And so in our survey, most of them have given their parents an F in terms of planning for long-term care events. Now, I don't know if that's going to translate into millennials, perhaps being more interested in long-term care insurance, but at least they have an awareness of the push-pull and the family dynamic that happens when there is a long-term care event in the family.
Well, let me ask you specifically about the market with a couple of examples. Suppose, let's say, a married couple, and each of them is caring for one of their own parents who 90, 95. That's one example. Another would be a single person of 60 who is caring, let's say, for both parents who are in their 90s. What can you sell them so the bad stuff doesn't happen to them, the bad stuff financially?
Go with that?
I think, what is in the market right now is an underwritten product. And that is one thing that if you put off the decision, you will face the fact that your ability to get underwritten will go down. So that is an encouragement to people to buy long-term care long before they need it.
Well, I think in the scenario that you paint with the couple, assuming that they're healthy enough and wealthy enough to afford a product, there's a lot of different approaches. Perhaps the couple would want to buy a shared benefit product. That has a lot of appeal. Statistically, only one of the two people is going to have a significant long-term care event. Buying a shared product is generally more economical than each one getting a product for themselves. I think your singles are going to have to pay more. We've discovered in the course of our underwriting that married couples are a better risk, so a single person is going to have to pay more than a married person. What we see single people gravitating to are the combination products, the life and long-term care products. A lot of times, the single person may have some insurance proceeds from a spouse that has already predeceased them, and so those products tend to be attractive to that group. It takes away that, concern about what if I buy it and I never use it. For what, single people, I think, are a little bit more conservative in that regard, and so if they buy something, they want to make sure they're going to get something out of it. So with a life long-term care product, they're going to, at the very least, be able to take advantage of the life insurance at some point. There are also a lot of products coming out around annuities. There's critical illness products. There's no end to the ways that you can attempt to skin the cat. It depends on how much you want to insure. You could buy a product that has a fairly long elimination period so that you have more of a catastrophic event product. Again, that's going to trim up the price for you. I think, though, that part of the challenge we have in long-term care insurance is distribution related. We don't have enough distributors that are well-versed enough to pivot and show the client the full range of products that might be available to them. And we don't have, as like with all individual products, there are not that many people that are going into the ranks of becoming an insurance agent these days. And so with those diminishing ranks, of course, we have a limited outreach to consumers.
How healthy do I have to be? Or another question,